Williams, and a pleasant good afternoon to everyone. This afternoon, it's my task, as per usual, to share with you the situation report from the Health Emergency Operating Center. Okay. Go now. Go ahead. Okay, all right, and so in St. Kitts and Nevis, at present, we would have reported 19 cases, that's 19 confirmed cases, 18 recovered, and at present, we only have one active case, and the patient is stable and recovering nicely. Can I pause? Is it the correct presentation? Okay, all right. All right, in terms of the CARICOM member states, we have a report of 42,217 confirmed cases, 28,855 would have recovered, and 831 deaths were reported. This dashboard provides you an overview of the status of the COVID-19 outbreak in our neighboring islands. For example, in Montserrat, they would have reported 13 cases, Dominica 31, St. Vincent and the Grenadines 64, Barbados 200, Bahamas almost 4,700, in Trinidad and Tobago almost 5,000 cases, and in Jamaica over 7,000 cases. So this provides an overview of the pandemic in our neighboring CARICOM member states. In the United States of America, over 7 million confirmed cases, total deaths 210,000. Globally, 37 million confirmed cases internationally and over 1,039,000 deaths. That's the death toll globally. So the pandemic continues to progress. In St. Kitts and Nevis, we continue testing our nationals who would have returned from hotspots and any suspected cases. So to date, we would have tested 2,586 persons. Between April the 24th to present, 435 persons would have returned nationals would have returned to the Federation. Okay, so in quarantine, we had the third batch of students at the Ross University School of Veterinary Medicine. They would have completed, I think, their 14 days of quarantine, and they are being discharged. Their tests have all returned negative, and today they are being, at present as we speak, they are being discharged from quarantine. So that's the third batch of Ross University School of Veterinary Medicine students. If you were watching CNN over the past few days, we all know that the President of the United States of America was recently diagnosed with COVID-19. Ladies and gentlemen, the virus is far-reaching. It even reaches up to the top. And President Trump joins a number of world leaders who have been diagnosed with this virus. He spent 3 days at the Walter Reed National Military Medical Center. He was recently discharged, and if we were following, we realized that he was treated, with a number of drugs: dexamethasone, a steroid, remdesivir, and we heard about Regeneron's antibody cocktail. All right, so dexamethasone is a steroid medication that's commonly used. We use it every day in the treatment of patients at the hospital or in the hospital setting, and so this medication is readily available. The trials that are being conducted in terms of the use of steroids in the treatment of COVID-19, there are some preliminary data that tells us that steroids can improve the chances of survival for patients with COVID-19. It seems to be beneficial for patients with severe disease. Remdesivir is another therapeutic agent that is being studied in terms of its effectiveness in treating COVID-19. And again, the studies that are being conducted by Gilead, they tell us that remdesivir seems to shorten the time to recovery for patients with severe COVID-19 disease. All right, and so these are two of the drugs being utilized in the clinical management of patients with COVID-19. And then we heard about Regeneron's antibody cocktail on the weekend. Now, this cocktail therapy is made up of lab-engineered antibodies. So there is a monoclonal antibody that targets the spike protein of the SARS-CoV-2 virus. And then there is another antibody that targets a different part of the virus. And so this Regeneron coronavirus disease antibody cocktail, it reduces the viral load in the persons who receive the medication, and it helps to improve symptoms in non-hospitalized patients more quickly than the regular standard of care. And so it is promising, but please note that these are early results, and so Regeneron is publishing these early results because so far only a small number of patients have been tried with this medication, and so this data has not been peer-reviewed as yet. But it's promising. So I just wanted to also this afternoon just recap, summarize the protocols that we will be employing when our borders reopen on the 31st of October. All right, and so just to reiterate that all travelers, inbound travelers to the Federation, you will be asked to log on to the national website prior to traveling, and you are to complete the entry forms, which will ask you for regular demographic information, immigration-related information, customs, and health questions. You also have to provide evidence of a negative COVID-19 PCR test done within 3 days or 72 hours of travel. And please note that this PCR test must be done at an accredited laboratory. All inbound travelers to the Federation will fall into two categories. And so we have the first category, meaning travelers coming in from the Caribbean bubble, any of the 7 Caribbean member states that constitute this bubble, and those coming from outside of the Caribbean bubble. In other words, those coming in from hotspots. And so if you're coming in from the Caribbean bubble, the bubble islands are Anguilla, Antigua and Barbuda, Barbados, Dominica, Grenada, Montserrat, St. Lucia, St. Vincent, and the Grenadines. All right, and so once you would have traveled directly from any of these territories to the Federation, let me just add, you would have had to be residing in a bubble territory for at least 21 days. And once you would have submitted a negative PCR test, upon arrival at the airport, you will be screened And when I say screened, meaning your temperature will be taken and you will be asked health-related questions just to make sure you're not experiencing any of the COVID-19 symptoms. You'll be asked to upload the National COVID-19 mobile application on your phone, and you will be monitored via the app at least for the first 14 days. Once you are found asymptomatic, meaning without symptoms, you will be allowed free entry into the Federation without a period of confinement or quarantine. Now, and then you are free to stay at a regular private home or any of the non-branded hotel properties. Please note that all arriving passengers from within the Caribbean bubble, if you were or if you have been in transit in a country or a territory outside of the CARICOM bubble, you will be categorized in the second category, which I will now go on to explain. All right, and so the second category involves inbound travelers, tourists, or returning nationals from outside of the CARICOM or Caribbean bubble. Now, if you are in this category, you will have a number of accommodation options open to you. All right, and so you can stay at one of the government designated facilities that are in vogue now as I speak. So that's the OTI or Royal St. Kitts Hotel in St. Kitts, the Oahu Beach Hotel or Portworx in Nevis. Or you can have your villa or your home assessed or evaluated by the task force, and once you meet the requirements, you can be approved or certified. Your home or your villa can be approved or certified as a potential site for quarantine or confinement. However, there is an attendant security facility, and the cost is borne by the applicant. And again, if you were to go on to our website, www.covid19.gov.kn, there is the pre-approved quarantine link on the site, and so you can just log on and complete your application, and it can be evaluated and assessed. And then your fourth option, you can stay at one of the franchise hotels. And so if you're in this category, you have a number of accommodation options open to you. And so the inbound traveler in this category will be required to submit a negative PCR test result done within 3 days of travel by an accredited laboratory. The traveler will be screened at the airport upon arrival, and as I said before, here the word screening means your temperature will be taken and you will be asked a number of health questions just to make sure or ensure that you are not experiencing any of the COVID-19 symptoms. You'll be requested to upload the SKN COVID-19 mobile application, and once you are not having or experiencing any symptoms, you will be allowed entry into the Federation, and you will be allowed to vacation in place at one of the accommodations I would have mentioned earlier. And if you would have chosen one of the franchise hotels, you will have access to an approved package of services within the first 14 days or for the duration of your stay if it is shorter. The international traveler will be required to do serial testing, and so on day 7 at your location your sample will be taken, it will be processed, and then on day 14 again you will be tested. If on day 7 if your PCR test returns negative, you have other options open to you. You can be allowed through the hotel's tour desk, and by appointment only, you can be allowed to access selective excursions or tourist destination sites on the island in a secure bubble. Okay, if your test on day 14 is negative, then you can be allowed to integrate into the society. Tourists in this category can only use or will only be allowed to use COVID-19 certified taxis or ground transport with appropriate petitions to move between the airport and your accommodation, the hotels, and to move between the hotel and the COVID-19 certified excursion and tourist sites on the islands. Phase 2. We've been getting questions regarding Phase 2 of our reopening procedures. Now, the second phase will involve an expanded list of hotels and accommodations that will be certified to accept inbound travelers with significant risk from hotspots. The second phase will also involve an expanded list of excursions and local tourist destination sites that are COVID-19 certified with the relevant protocols. The second phase may also involve further changes to what we would have explained earlier. And this will be based on surveillance data that we will be collecting and the outcomes observed in the first phase. So, ladies and gentlemen, we cannot prevent a second wave of infections, even though our borders will be opened on October 31st. How can we do so? There are a number of measures that we can take, and it's very important that we get back into the habit of wearing our face masks when in public spaces. I think we have gotten a bit complacent in this regard, but that's going to help you to reduce your risk of exposure to this virus. All the stakeholders within in the front line at our borders and in the hotel and tourism sector, it's important for you to adhere to the infection prevention and control measures to ensure safety of yourselves, the frontline workers, safety of the people of the Federation, and safety of the traveler, tourists. It's important for us to always remember hand hygiene, good hand hygiene, and sanitation, especially in the school setting where you have a number of persons gathered for many hours, in the workplace setting, in the business place, and other high-risk settings like the prisons and nursing homes for our older adults. Ladies and gentlemen, physical distance is also very important. We need to maintain a minimum of 3.3 feet or 1 meter between persons when in public spaces. And we need to be responsible as individuals and collectively in avoiding crowds and gatherings of significant numbers of persons. When you look at CNN as to what's happened in the US, you realize that these functions are now deemed as super spreader events. And so if protocols are not adhered to, a simple function or social gathering or event can become a super spreader event. All right, and so we need to be responsible and only attend those that are absolutely essential, and be more selective in where you go and what you engage in as a means of reducing your risk of exposure to the virus. Dengue. All right, so this is far removed from COVID. However, it's very important. St. Vincent and the Grenadines, I think, they have reported a few cases of dengue, and I think there are a number of cases, about 4 or 5 cases that I've heard about in Antigua. And so dengue seems to be lurking around us again. And so as a federation, we need to be very careful in terms of how can we prevent an outbreak of dengue here at this time in the context of COVID-19. And so again, each and every one of us, we have a responsibility. What can you and I do to prevent an outbreak of dengue locally? And so it's important for us to be mindful of our immediate surroundings, meaning at home. Let's start at home and in our communities, in schools, and by extension, workplaces. We need to prevent mosquito breeding sites. Empty, clean, and dispose of containers that can hold water, because that's where the mosquitoes lay their eggs, and then the mosquito density increases. So we need to walk around our homes and get rid of all those empty, dirty containers where water is stored. We are enjoying a period of good rainfall now, and so it's important for us to do so. Make sure our screens are intact, plug the holes, keep the mosquitoes out, use insect repellent where appropriate and when necessary, and dress appropriately when going out in the evening and at nights. And then we can opt to sleep under a mosquito net. These are some of the measures to ensure that we prevent an outbreak of dengue. Eliminate standing water. And so, you know, if there's a puddle of water that you can control, I think we all have a responsibility to deal with it. Thank you.